Health, they say, is wealth. The resident doctors of Nigeria on Monday commenced a nationwide strike as a result of failed series of meetings between the federal government and the doctors. Today, we are at the hospital to know how this has affected both the patients and the doctors.
It's not funny. It's really not funny because in subsequent times, if you come to the hospital, like I came for antenatal, you come and the queues are very short. You just see doctor and then off you go. But today, entering alone, the crowd I saw entering through the entrance, I was even surprised and afraid too. And when I got there, it took me a while before I saw the doctors, and I noticed some of them are not there. We have few doctors. It took so long before they called me to see one finally. So it's really not easy.
Well, it didn't affect me much because I had my eye operation surgery yesterday in the morning. Then this morning again, they removed the plaster and the other things. So it didn't affect me much.
While speaking to YANS, a senior resident doctor of the hospital had this to say.
Yes, there's been an increased patient load. Um, the GOPD is really filled up. Currently, we're having to open extra consulting rooms and further add some more manpower to be able to cope with the um, influx of patients. We're having a strain in trying to schedule patients for certain procedures. There's also a backlog we're trying to work to clear out as well. But yes, it's one of those things you would expect. Um, it's one of the advantages of the public-private setup or the private hospitals as well, who would not go on, are still working at this point in time. And I think it would just be right if the government could actually consider throwing some assistance to establishments like ours to help at least go through trying times, At times when there's a result or something comes out of these industrial actions, yes, we also should be remembered. We also should be remembered, and it should also trickle down to us in the doctors working in the public-private sector and those in the private hospitals as well. Because we still are here providing that service.
The patients in the hospital, however, called on the federal government to do something about the recent developments.
The strike thing came to us as a shock, in this period that we are facing a whole lot of issues in our nation. And I'm hoping that the government will see to the plight of the doctors and sort it out once and for all so that everything can be resolved and life goes back to normal.
It is hoped that the government will rise up to the task of settling things amicably with the health workers. Alisa Samuel, reporting for YANS TV.